If families are concerned about which place they should go to, an urgent care versus an emergency room, there's a couple differences that you have to keep in mind between the two facilities. An urgent care is equipped to handle minor medical complaints and kind of minor emergencies. Things like ankle sprains, cough, cold symptoms, flu-like symptoms, slight fevers, things like that. Urgent cares are typically more limited as far as what tools they have access to fully diagnose someone's condition. Freestanding emergency rooms that are different than urgent cares because we do have capabilities more with technology with ultrasound and CT. And what's nice is that we're all interconnected. So for example, if a patient is seen at Del Sol a couple weeks ago for some other problem, and then they go to Las Palmas for something else a couple weeks later, we actually have access to Del Sol's records and studies and doctor's notes, and we can know exactly what they did at the other facilities, which makes my job a lot easier because then I can see what happened to this patient if they're not sure what they were admitted for or what kind of problem they had, what they were diagnosed with. We can just look it up real easy. So we have a freestanding emergency room on the west side, in the northeast, on the east side. We have Del Sol on the east side, Las Palmas on the west side. So we're pretty well positioned around the city to be able to take care of anyone. If someone's unsure of where to go or if they should come to the hospital versus the freestanding emergency room, depending on where they live in the city, the safest answer is to call the ambulance, call 911. EMS crew is specialized in identifying, who's potentially sick and where they need to go. They're experts at triage, basically. People should pick Las Palmas Del Sol because it's inspiring to be able to work with people that, work as a team so effectively. It's nice working in a place where I can rely on my colleagues and I know that they're going to be taken care of.